Well, after Christmas and New Year's, America is experiencing a spike in seasonal sickness. The CDC says the number of people suffering from respiratory illnesses is high in 2/3 of the United States and rising. CBN medical reporter Lorie tells us what's driving the surge and how you can protect yourself and your loved ones.
Doctors typically see a spike in cases of respiratory viruses like the flu, COVID, and RSV after the holidays because of all the travel and in-person gatherings in close quarters. Doctors warn the post-holiday surge may continue for weeks.
It's probably going to get worse before it gets better.
Testing is the best way to determine which infection a patient has because symptoms often overlap. They include sore throat, cough, fever, and body aches. Severe symptoms include difficulty breathing and chest pain.
We think that influenza probably has a more sudden onset after you contract the virus within usually 1 to maybe 4 or 5 days. COVID-19 symptoms might start anywhere between 2 and maybe 14 days after you contract the virus.
For some viruses, doctors can prescribe pills that have been proven effective, but the drugs need to be taken as soon as possible.
With influenza, we have an antiviral medication called Tamiflu, which is only helpful if it started within 48 hours of the beginning of your illness. For COVID-19, there is an oral medication called Paxlovid, which can be started within 5 days of the onset of your symptoms.
RSV, on the other hand, is not treatable with any prescription medication.
So RSV is a virus that many of us are familiar with, unfortunately, that can really hit the little kids hard, the little ones, the infants. Hospitalizations happen every single year from RSV.
Doctors say parents should take their child to the doctor if they're not drinking enough, have bluish lips or fingernails, or have short, rapid breathing.
You might see little ones where you can see the outline of their ribs, and we call those some retractions. You can see their muscles working extra to help them breathe.
Fortunately, most RSV cases are mild. Pediatricians often recommend children's acetaminophen or ibuprofen for comfort.
In general, the cough medicines we don't recommend across the board. They have other components in them that aren't necessarily useful or helpful for kids. One that is useful is over-the-counter honey for a year or more. Sometimes that can soothe the throat and give them a little relief.
Doctors say regardless of age or ailment, we can prevent the spread of respiratory viruses by washing our hands often, covering coughs and sneezes, and staying home when sick. Lorie Johnson, CBN News.